Welcome, everyone. We'll get started at about 3 after the hour, but in the meantime, we have an opening question for you. So if you are a school nurse teacher or anyone who's affiliated with a school, please put in the chat what strategies you found to be successful in helping students get vaccinated. And then at the end, we can read these out and discuss during our question and answer portion. So take just a minute or so while you're waiting to get started to drop those responses into the chat, and we'll get rolling in about 2 more minutes. Welcome, everyone. If you're just joining us right before we get started, we invite you, if you are a school nurse teacher or affiliated with a school, to just drop the answer to our opening question in the chat and share with us any strategies you found to be helpful in getting students vaccinated. And we will discuss some of these during the Q&A portion of the webinar. So we will get started in just about 30 seconds, but take a second to drop an answer to that question in the chat for us. Well, welcome, and thank you for joining today's Shot of Knowledge webinar, Back to School Vaccinations in Rhode Island. My name is Dr. Shelley Fiskus. I'm a pediatrician and the Chief Medical Officer for the Association of Immunization Managers, also known as AIM. AIM is a national nonprofit that supports the federally funded immunization programs, including Rhode Island's immunization program. Next slide, please. Before we get started, let's just cover a couple of housekeeping items. A recording of today's webinar will be available on Rhode Island's website in the coming days. And the views of the presenters are their own and do not reflect the respective organizations that they represent. Please put any questions you have for the speakers in the Q&A box, and we'll address as many of those as we can at the end of the webinar. And at the end of today's event, you'll see a brief pop-up survey. We'd really appreciate your thoughts on this webinar so that we can be sure to bring you the educational content that you need. Next slide, please. So for today's agenda, we'll start out by learning the learning objectives and introduce today's speakers. First, we'll hear about school vaccine requirements in Rhode Island and learn more about coverage rates. And then we'll hear from a pediatrician who will share his perspective on how to engage parents during back to school season. We will have time for Q&A with the speakers at the end, and we'll close out with some resources for you. Next slide, please. So our first speaker today is Dr. Tosin Ajubele, the medical director of the Divisions of Community Health and Equity and Environmental Health at the Rhode Island Department of Health. She is also assistant professor of pediatrics and practices primary care in the community. And then following her, we'll hear from Dr. Boris Skurkovich, a pediatrician with Providence Community Health Centers. Dr. Skurkovich has worked in general pediatrics and pediatric infectious diseases for about 40 years. He is a clinical professor of pediatrics emeritus at Brown University School of Medicine. So I will turn it over to you, Dr. Bailiff.
Thank you so much, Dr. Fiskus. Good morning, everyone. So I can jump to the next slide. Thank you. And the next slide. So I'm going to talk a little bit about our school immunization requirements in Rhode Island. So those are implemented via our state regulations per our Rhode Island general law. And the full regulations can be found on our Secretary of State's website, and the links are here. And you can also find additional information on our webpage that lays out for each entry level in terms of grade what those requirements are. And I'll be going over those a little bit more extensively in this presentation. Next slide. So for kindergarten entry, I kind of like to think of this as sort of 5, 4, 3, 2. So for kindergarten entry, children must receive 5 doses of DTaP, 4 doses of polio, 3 doses of hepatitis B, and 2 doses of MMR and varicella. Additionally, all children need documentation of a dose of polio that's given after 4 years of age, even if a 4-dose series was given before they were 4 years old. And that dose of polio vaccine given at that time after 4 acts as a booster, which is necessary because the early childhood doses at 2 months, 4 months, and 6 months can wane in effectiveness. So that final dose ensures lasting immunity against polio. So that's the reason for the requirement after 4. Next slide, please. So now we're looking at the requirements for middle and high school. So for 7th grade, we do require 1 dose of Tdap, 1 dose of meningococcal, and at least 1 dose of HPV for 7th grade entry. For 8th grade, the expectation is 2 doses of HPV, and by 9th grade to be up to date with HPV vaccine. We know that with HPV vaccine, depending on the age of administration, it can be 2 or 3 doses. For 12th grade, the expectation is to have that 1 booster dose of meningococcal by that time. And next slide. So walking us through the exemptions in our regulations. So there are 3 types of exemptions: medical, religious, and temporary exemptions. So medical exemptions are only those obtained through a licensed healthcare provider. Religious exemptions are available online or by the school. And temporary exemptions are for those students who are in the waiting period for the next dose of their vaccine. So again, that is when a student, for example, might be between multi-dose series, and that temporary exemption is only good until their next appointment. So again, that is temporary. And all of the information about those particular exemptions, as well as those forms, are available on our Rhode Island Department of Health website. And next slide. So when we think about exclusions, so this occurs in the case where students who have not received the minimum number of required immunizations, who are not in a prescribed waiting period between doses, and who are not exempt, are excluded from preschool or school by the administrative head of that school pending the completion of the required doses of vaccine. So, upon initial entry to any preschool or school, this exclusion is required unless evidence is submitted that the student has received initial doses of required vaccines. Um, what about times of outbreak? How do these exclusions work? So that is determined in consultation with the department and with the school. So if an outbreak of vaccine preventable disease should occur, and a student has an exemption, that student should be excluded from school by the head of that school for a period of time as determined by the health department in a case-by-case analysis of the public health risk. So that is determined by the department, again, in collaboration with the school as well. Next slide, please. So I'm going to switch gears to talk a little bit about our immunization data and our coverage rates in our state. So our Rhode Island Immunization Data Hub provides immunization data on different populations, and it compiles this from a variety of sources. So we have data on children, 0 to 18, school-age children, kids in childcare, as well as childcare workers, information about vaccination rates for healthcare workers, as well as adults in general. So we get that data from our Rhode Island Child and Adult Immunization Registry, or RICARE, as well as annual immunization surveys. So all of this data is available online to everyone. And we collect the annual immunization surveys in order to meet compliance to our immunization regulations. And that data source also collects information on exemptions. Next slide, please. So this snapshot gives us a look at our annual school immunization survey for kindergarten. So it shows the percent of kindergartners who are meeting the school requirements. And our kindergarten rates have remained really steady over time. We have 95.2% of our kindergartners meeting school requirements for the 25-26 school year. We do, however, see when we break this out between public and private schools, that private schools in that dotted line are consistently lower than the public schools, and we have 92.3% meeting requirements of the private schools in our state compared to 95.6 of the public schools. Next slide, please. And this graph is also from our school immunization survey. And again, this is the only opportunity that allows us to collect data on exemptions. So it is truly a really important piece of data that we collect. So when we look at this, since 2021, we have seen a small but fairly steady increase in our religious exemptions in the state. So for the 25-26 school year overall, 2% of kindergarteners had a religious exemption. And this exemption can be for one, a few, or all of the required vaccines that I reviewed. The good news is that this is still well below the national average, which is 3.4, but the increase that we have been seeing since 2021 is a bit of a concerning trend, and we continue to monitor that. Private schools have and have always had a much higher religious exemption rate at 3.4% compared to 1.8% of our public schools. And next slide. So now this is providing a snapshot of our immunization rates at the municipality level. So this again looks at the percent of kindergarteners who are meeting those school requirements. And that red bar that you see right in the middle is our state average. So all of the municipalities to the left have higher rates than the state average, and those to the right have lower rates than the state average. So this data is used to help us to focus efforts in terms of the municipalities where they're most needed and working with schools and providers and the community in our attempts to continue to increase vaccination rates. And next slide, please. So, I want to talk a little bit about our school-based vaccination clinics. So, we have our fall school-located vaccine clinics, and it is an offering of flu and COVID vaccine, and that's done at over 200 host schools across the state between October and December each year. And the full schedule can be found on our website, which has also been provided in the chat. Um, we also have the Vaccinate Before You Graduate program, and that's open to middle and high school students. So that is an opportunity where all routine vaccines are available, and students should be visiting their healthcare provider every year for a well care visit in order to make sure that they're meeting this requirement. So the Vaccinate Before You Graduate program actually began in 2001, and the program was designed to help high school seniors complete their hepatitis B vaccine series, but it's now expanded since 2001 to include all routine vaccines, including flu and COVID, to middle and high schools across the state. So both for our fall school located vaccine clinics, which are actually open typically to the public as well. So even if it's not, you don't have a school age child, you can still attend these vaccine clinics to get vaccinated with flu and COVID in your community. So it truly is a great opportunity. Um, and registration can again be found at the link that was provided in the chat, and that typically opens in September, and this runs throughout the fall. So both of these programs, there's no out-of-pocket costs. No one has to show up with funds in order to get vaccinated. Um, but we do collect insurance information if people have it with them, which just helps to ensure that the programs can continue to offer clinics to as many schools as possible. But it's not a requirement in order to receive vaccination, and no one gets turned away if they don't have insurance. So truly an exciting opportunity to continue to increase vaccination rates and acceptance in our state and in communities where people live. Thank you so much. Back to you, Dr. Fiskus.
Thank you, Dr. Ojibele. Rhode Island is just, I mean, honestly amazing with its efforts. You lead the country among states with immunization rates and clearly above the national average for nearly every kind of vaccine there is. So I hope everyone appreciates how hard it is to get that done, especially in this environment. And what a tremendous job the state of Rhode Island does. Thanks for all the information you shared. I'm going to turn it over to Dr. Boris Skurkovich to give us some thoughts on his experience as an on-the-ground pediatrician trying to improve immunization rates in his part of Rhode Island. Over to you.
All right. I don't have any slides, and just kind of give you my ideas about vaccinations and how to approach them. I work at very busy community health centers and in Providence. Most of our patients are foreign-born or non-English speakers. And first occasional situation that arises when people arrive with their records of immunization in their native country, and you have to spend quite a lot of time occasionally to decipher them to see if the child needs certain immunizations for school. And our nurses are getting very good about that. Occasionally, records really don't make sense, and that's sometimes a challenge. In my experience, people coming from other countries who are trying to enroll their children into school usually don't have any issues with immunizations, except for, in my experience, kids coming from Ukraine and sometimes from Russia. The reason they come to me is because I speak Russian, so I can communicate with all of them. And I know that some of those vaccinations are fake, but that's exception. They very often would kind of invoke the religious exemption, and I try to explain to people there's a difference between exemptions or requirements for school and exemption of the requirements that they get in the doctor's office, meaning that people feel if they told me that they don't want to be vaccinated and I document in the chart and say it's okay, then they automatically would get into school. It's a very different story out there. Um, so in my experience also over the years, is that we are pretty good about catching students who come to our office not for well child care, but for sick child care. And we try to use those opportunities to catch up with their immunizations. So to assist us, what we did, we created a kind of a table like this I'm going to show you. And you don't need to read the up. So anyway, it's a table of what needs to be done at each visit. For example, that will say at 18 months of age, you get DTaP number 4, hepatitis A number 2, and so on. And so nurses who work in pediatrics, they're very familiar about what needs to be done, but we frequently would have floating nurses or nurses who are not really familiar with pediatric schedules. And for them, it's a very uh, useful tool to use and to see whether this child needs to be immunized or not. But in reality, we're very busy. So our schedule is packed, and it's difficult to squeeze in one or two extra person requiring immunizations. What we started doing also uh, is changing a little bit our schedule for teenagers. If you look at what needs to be given at 11 years of age, it's Tdap, meningitis vaccine, HPV. But what I started doing, I started actually giving these immunizations at 10 years of age for a couple of reasons. One, Tdap is something that is given every 10 years. So it's easier for people to remember that if they got their shot at 10 years of age, then next time it's 20, 30, and so on. HPV vaccine is licensed down to 9 years of age, and it's very immunogenic. In fact, the younger you are, the more immunogenic it is. So I give HPV vaccine number 1 at 10 years of age. So at 10 years of age, they get their Tdap and HPV. And then a year later, when they come back and they're 11, they get their second HPV and meningococcal vaccine. What's interesting about HPV and flu are vaccines that get the most pushback from parents, and COVID as well in season. When you talk to them about HPV at 10 years of age, what I find that parents don't bring up anything related to sexuality or sexual activity. When you start at 11, very frequently this question will come up. I don't know how to explain this, but it plays out every single day. So by doing that, by 11 years of age, they would have received all of the vaccines, meaning Tdap, meninge, HPV. And what's interesting about the meningococcal vaccine that it's very durable, and it works for a number of years. We were told that not to give meningococcal vaccine before the age of 11 because it won't be counted. I don't know whether it's true or it's not true. Um, so that's our kind of strategy to um, get teenagers in and immunize them as soon as possible against those four um, conditions. With younger children, we usually don't have much problem. We do have a little bit of an increase in vaccine refusers, and usually you can detect by talking to the parents how kind of determined they are to prevent vaccination of their children. I've been doing this for 40 years, and so I have hundreds of patients who are now parents who I used to take care of before. And all of them have been immunized. But when they come to their children, they're now, asking questions and doubting that it's important. So with some of them, when I see that it's kind of a lost cause, I say, okay, that's fine. If you don't want to vaccinate, that's fine. But I will talk to you about this every single time you come in. And they say it's fine with them. At some point, some of them will say, well, I just want one vaccine. I want to create my own schedule. In the past, I would totally tell them, no, you need to follow what we're offering, and that's the school requirement, and that's what we require. But with age, I guess I became a little more flexible. And if I feel that we can give a vaccine to a patient, it's vaccine given. If we don't give it, then this child will be totally unimmunized. The other reason also to do all this is I'm afraid, and sometimes I'm right, that people who don't want to vaccinate, they actually stop coming to the clinic altogether. The thinking is, if I'm not there for the shots, then I really don't need to go. But with primary care, you probably do want to see them, especially if it's new baby in the house. In the past, we used to have immunization clinics, but as far as I know, it became a little difficult to line up the staff and the patients. But I'm not sure about that because I really don't know who makes that decision. But in the past, immunization clinics were very successful. And I think one of the reasons why they were successful is that we would offer physical exams at the same time to kids who are behind. All this applies to our own patients. We will not, as far as I know, have patients who are not ours just walk in and get immunizations. Vaccinate to Graduate is a great program. Occasionally, we have a little issue with that program putting everybody into KidsNet, but those problems are minor. So my kind of advice is to work on those parents every time that you see them, whether it's in school or in the clinic, and especially if you're dealing with the people hesitating to vaccinate. And eventually, most of them will turn around and it will partially immunize their children. The last point is I want to emphasize again that parents don't understand very frequently information about exemptions. I had patients recently who told me that I don't want to have any poison in my child's blood, and then she takes out the exemption form for me to sign. I said, well, it's a little disconnect here. So we all talk about vaccine refusers and increasing the number of them. But as Dr. Ajubeli's slide pointed out, it is a small increase. Of course, you know, the population based, we're talking about hundreds of thousands of children, but we're talking about, you know, Rhode Island, your particular school, your particular clinic, the refusal rate is still, or being behind on immunizations is pretty low risk. So I'll stop right here and see what's next.
Thank you so much for all of that insight. So much of what you said resonates with me and my experience and practice. That we were one of the only practices in our county when I was practicing in Tennessee that would take families that did not adhere to the CDC schedule. And I had the same philosophy that you did, that I would rather have a partially vaccinated patient than a completely unvaccinated patient. There were also some charlatans practicing on my block that were completely against giving vaccines and then prescribed things like Helminth therapy and organic clay and hyperbaric oxygen treatments. And so part of my goal was also to keep those families out of the hands of those practitioners that were the only ones in the area besides us that would take children who were not fully vaccinated. So I know that there was a big trend towards not accepting families into a practice if they didn't adhere to the schedule, but you can see those other negative consequences to taking such a hard line on that. And my experience was very similar to yours, that if you let them go one at a time and tell them they have to come back every month to get a new one, by the time they get to month 2 or 3 and see that nothing's happened to their child, a lot of times it becomes too inconvenient to come back and they decide to just get the rest of them done. Is that kind of what you've seen as well?
Yeah, yes. The other thing, what I see, um, let's say it's a mother who brings the child every time, or the father, just one of the parents, and refuses the vaccine. And then next time another parent will come in and will ask them. I said, sure. I said, okay, here's your 4 shots. So use every opportunity to vaccinate, because those of us who've been around, seen all these diseases in reality, measles and H. flu meningitis and varicella that is bad. So it's worth vaccinating.
Absolutely. The other thing that you mentioned was starting your conversations around HPV vaccination early and trying to get those kids vaccinated at 10. And the things that you talk about in your practice, starting early, the conversations are easier. They tend not to be so focused on sex and more on, just, yes, give my child a shot that prevents cancer. That is being played out in evidence across the country as we see states start to adopt a movement towards vaccinating kids at 9 or 10 for HPV. So I think, even though you said that you didn't quite understand what the change was between 10 and 11 in the conversation, we're hearing that over and over again across the country.
Definitely.
There's really good data out of the state of Washington about completion of HPV series before age 13 being so much better if we start HPV vaccination at age 9 or 10. It gives a longer runway to get those vaccines done by age 13. And a lot of times the acceptance of that is much higher at that age. So you're cutting edge there in your practice and in getting those kids vaccinated at a younger age. So
Yeah,
congratulations for
yeah,
that.
that's the thing to remember about HPV. vaccine. It's one of those few vaccines that provides you almost 100% immunity against the strains that are in the vaccine. So if you give them one shot and they disappear for 2 or 3 years, they are still immune. The the persistence of antibody levels is very long. So don't despair that, oh, there's only one HPV. At some point, they'll get their second one, but they're already protected.
One is better than none, for sure.
Exactly.
I'd like to, we do have a question in the Q&A that I'd like to have Dr. Ojibele address. So as far as the exemption form, is there a timestamp on when religious exemptions or medical exemptions need to be renewed in the record?
Yeah, so in terms of the exemptions for temporary, I'll start with the temporary exemption. So those expire on the date of the scheduled immunization appointment. So again, those temporary exemptions are only for those students who are in between multi-dose vaccination, and that exemption expires on the date of their immunization appointment. Um, in terms of the religious exemptions and the medical exemptions, within our current Rhode Island general laws, there is not a time stamp specifically on expiration of that exemption.
Thank you. Um, So, to either of you, are there resources that your written resources that you tend to point parents in the direction of if they have a lot of questions around vaccines and specifically, are there resources around COVID vaccines, maybe concerns about myocarditis that have been reported in the past, that you point parents to reliably for good information that covers things that you might not have time to cover in the office appointment.
Dr. Skirkovich, I'm not sure if you wanted to go first, but I was just going to mention the vaccine information sheets. And that is something the CDC VIS for COVID vaccine we continue to utilize in our clinic and give to families with every immunization, as well as those families that have some hesitation and questions. Those information sheets are available to them. And that information sheet within our clinic also does talk about myocarditis and the very low risk of that. Additionally, we point to the American Academy of Pediatrics and healthychildren.org, their parent-facing website, as a source of reliable and accurate information for families. And lastly, I actually found a really nice information sheet for parents specifically about myocarditis from the Vermont Department of Health. And they are our close partners. And as part of the Northeast Public Health Collaborative, folks that we, again, also collaborate with. So I'll put that in the chat because that's a really nice information sheet. I think some of the most important things that we do is just talking to our patients. I think the ability as a trusted source, whether that is a school nurse teacher that a family sees frequently, or their provider, that can be certainly a trusted source. So talking to families, understanding their concerns, and then speaking to the fact that risk statistically of myocarditis is extremely low. And the fact that COVID-19 itself can cause myocarditis. And in terms of, again, those few who do develop myocarditis after COVID-19 vaccine, they recover very well, often with little to no medical treatment.
Yeah, we also use vaccine information sheets in the language of the parents. We give it to them every time child is brought in for well child care or immunizations. And frequently, it's very infrequent that actually parents have questions. But if they do, then we address the questions. The other little point I want to say is, and that's the literature is pretty good about that. It's about how do you tell parents that your child is going to have vaccinations today. So I never say something like, "Oh, and how about flu vaccine today?" or "How about your 2-month-old shots?" To me, it's the part of the package. So we talk about nutrition, we talk about this, we talk about that. Your child is getting 2 shots today. We'll see you in 2 months. So as a part of a routine, that's how I do it. If you walk into that room and start negotiating from the get-go, I think you may end up on the losing end. But if you can, especially if you know your patients well and you know who can tolerate what, then you'll be successful.
Yeah, absolutely agree. The that presumptive recommendation, this is what to do today. And moving on is something that's tested out in the evidence over and over as being one of the best techniques that we have to getting kids fully vaccinated. One of the things that I found in my practice was that sometimes that presumptive recommendation was undone by maybe someone on my office staff. A mom calls and talks to maybe a receptionist, asks which vaccines are due, and they say, well, these two are required for school, but this one isn't, and I wouldn't get it for my child. What's been your experience with helping to educate clinic staff to make sure that the message that's being said to parents from across the experience in the clinic is a consistent message?
Well, we operate in a team fashion, meaning we have a provider, a nurse, and medical assistant, and per provider. So we have, for example, 3 teams running at the same time. So I have nurse who is consistently with me, medical assistant who is consistently with me, and they know what I do, and they know that this sheet is what they're gonna use, and it makes their life easier because it's a part of the deal, and they usually don't talk about vaccinations with the parents. It's not their role. It's a nurse and me. Uh, so we don't get that. Now, of course, especially with COVID, it depends upon the enthusiasm of the clinic and the personnel whether your immunization campaign will be successful. And the enthusiasm for COVID vaccine right now is low. I can tell you that. So whether in the fall something will change, hard to tell. Flu is another one. That's a tough because some people are just absolutely no flu because in people's minds sometimes the flu and a cold is the same thing. And so, the child got sick after his last flu vaccination a year ago. So it's hard to kind of fight. But in the middle of epidemic, it's a little different. But if somebody comes to you in September or October and say, let's give this kid a shot against flu, everybody looks at you and why? It's still warm, everything's good. So there is an educational component here as well. But we try to separate roles of the clinical team. Medical assistants, they have enough to do, prep the, take vital signs, put the kid in the room, ask questions. I don't think they are into advising against or for immunizations.
And you mentioned, Dr. Ojibele, I think you mentioned healthychildren.org, AAP's parent-facing website. They have one particular document called Examine the Evidence that I think is particularly good. It goes through a lot of the kind of hesitancy claims and some of the misinformation that is routinely broadcast, and actually links to the papers and the evidence that disproves that particular claim. So AP does a great job of keeping that resource updated. And we'll try to get a link to that into the chat or out in the resources afterwards. But that's one particularly excellent piece that healthchildren.org has out. So really like that one. I've also, if you're not familiar with immunize.org, they are a national nonprofit that really works on the provider education side of immunizations and providing clinical resources. I put in the chat a link to the international translations of the vaccine information statements. So they have, I don't even know how many different languages that those VIS forms have been translated into. So take a look at that if you work in an international or with an international population. They also have a chart kind of similar to what Dr. Skurkovich was showing, which is the different languages and the words for those different vaccine preventable diseases in a chart. So you can look at that as well if you're working with international populations, and it might make things a little bit easier in translating those vaccine records that are there. I did want to circle back to the opening question that we had, which was asking school nurse teachers and others who are affiliated with schools what they have found helpful in getting children vaccinated. We saw a lot of comments about school-located vaccination clinics, which Dr. Ojibele, you talked about the importance of that in Rhode Island, over 200 sites a year. Making vaccination the easy choice. If it's right there, ready for you, and you don't have to take the child out to someplace else, then that makes it really, really easy. We also heard about making sure that everything is explained in plain language and in a way that people can understand. And then making sure that you have translated resources that are also available and culturally appropriate for those audiences that are coming from other countries and needing to get their children vaccinated. I frequently had children from European countries that came over, and the recommendations are different in some of those countries, and I would maybe work with a family from France where varicella vaccine wasn't recommended. And those conversations take a little bit longer to get through because the recommendations can be different from country to country. A lot of European countries also don't have school entry requirements like we do in the United States. So sometimes that takes a little bit of explaining as well. But those are all great things to make sure that you have in place to help get those families vaccinated. I did want to see if there were any school nurse teachers or others affiliated with schools on the webinar who might want to raise a hand and talk a little bit about dealing with religious exemptions in schools. That can be something that I know is very frustrating. When I was over the immunization program in Tennessee, I would have school nurses call and say, a parent literally told me they didn't have time to get their child vaccinated and therefore wanted to fill out a religious exemption form. And, how frustrating that can be. So I'll give a second if there's anyone. You can put your name in the chat and we can unmute you, or you can raise a hand if you'd like to come off of mute and talk about your experience with that. Um, and Katie and Kendall, I might not be able to see hands if they go up, so please let me know if you see a hand go up. In the meantime, Dr. Strkovich, when you've had people come into the office saying that they plan to claim a religious exemption, what does that conversation tend to look like?
Well, it depends upon how much time I have. Like first is that many years ago there was an article in Vaccines which reviewed all religions and the attitude of different religions towards vaccinations. And basically, every major religion teaches us to protect our children and not harm them. And every major religion, none of them have a prohibition against vaccines. The only one church, it was a Dutch Orthodox church, I think in Pennsylvania, that was actively against vaccinations. So when people tell me, "Oh, I claim religious exemption," I say, "What religion is that?" And you know, they just they don't have an answer.
Mhm.
Okay, so I try to work on them and say, "Listen, religion doesn't prohibit it. In fact, it's the other way around." That I tell them, just remember, fine, you can go to school and claim religious exemption and they'll let you in. You come back to me and you want me to to clear your child for sports and he's unvaccinated. I don't care about your religious exemption. It's not between me and them, it's between school and them. So I'm not going to clear them. So they have to understand this difference between medical provider and school provider. People find their way around. I have a whole bunch of kids who go to small religious schools in Attleboro. So vaccinations there are not an issue at all. I mean, they allow them to come in. So it is a little tough. But again, the numbers are relatively small, thankfully, in Rhode Island. We're talking because we remember probably each one of them. There's so few. And I think, it will calm down a little bit soon, hopefully, and we'll get more kids vaccinated. And sometimes parents, something clicks. I have infants coming in 2 months, they don't want shots, to 4 months, they don't want shots. Suddenly at 6 months, they say, okay, give them one shot. Okay, we're fine with that. So it's not that somebody totally stuck in their philosophy. People change.
Yeah, I think that's one of the frustrating things too, when you have, you had said that you sometimes have parents that were fully vaccinated who now bring their children who are pushing back on and getting vaccinated, or you have a parent who has one child who's fully vaccinated, but now has a younger child that is saying, we're not going to vaccinate, or we gave all the vaccines when the child was younger, but now we're not going to do the older vaccines. So that inconsistency, where they're going to use a religious exemption or in some other states a philosophical exemption, when clearly there's a history that they've followed the guidelines before, I think can be really frustrating for folks too. Well, and we have one comment in the chat. It says, it's very frustrating when parents use this and they are clear that it is the inky one that allows them to decide when to vaccinate their child or even if they will vaccinate. Often this flows back to their political views. We always highlight our goal of best safety for the child, but it is a loophole. And I think we need to work on that. So, oh, only one, not inky one. Got it. Thank you. Yeah, and there are states that have been able to remove non-medical exemptions. I think there are 5 that currently have that. They have a battle every year in their legislatures as folks try to undo those bills, and so far they've all been able to hold on to them. But it's it's a difficult thing, and certainly there has to be political will in the state to be able to get a measure like that to get over the finish line. So even when you have um, removed non-medical exemptions, you still battle that situation every day. So I think what Dr. Skrikovich is saying, it's a small minority of people, and maybe spending more of our energy focusing on kids that truly just don't have access or have for other barriers not been able to get vaccinated, that the juice may be more worth the squeeze and trying to get those people who are willing. Um, I do want to point you to one other resource, and Katie can maybe throw this into the chat too. The National Foundation for Infectious Diseases has a adult vaccination dashboard where you can actually go in and go to Rhode Island and then look at specific zip codes in Rhode Island and see about the adults' willingness to be vaccinated against the respiratory pathogens specifically. So you can see what the vaccination willingness is in a particular zip code, which can sometimes help you craft messaging or target particular areas. And then it will also tell you where the people in that zip code tend to get their information, whether it's from TikTok or one of the national news channels or Facebook, and what types of messages will resonate with people in that particular zip code. So it's a really fascinating resource. It's really interesting to dig through. It's publicly available, and it is a nationally representative survey that was done, I believe, in January of 2025. So still pretty recent data, but you might want to check that out for your state as well. Well, we are just about at time. I do want to close out with some great resources in addition to the litany of things that we've put into the chat, that there are great resources available to you all from Rhode Island and from AIM. Rhode Island Department of Health offers a comprehensive guide that covers vaccinations needed for every age. And so that's a great resource for families. And they've created flyers in English and Spanish discussing measles and kindergarten vaccine requirements. And for more information, you can visit their back to school webpage. And for any of our school partners on today's call, AIM has a school located vaccination clinic toolkit that includes comprehensive resources to support your efforts. And we also have talking points with key messaging to help communicate the importance of school vaccine requirements. So all of those links are also in the chat for you and will be available on Rhode Island's site, and as well as a recording of this webinar. So the next Shot of Knowledge webinar will be held on September 29th at 8 a.m. And this will be about the fall respiratory virus season. Registration is open now. And if you'd like to see any of the past webinars from this series, please visit the Rhode Island Department of Health website. So thank you again for joining today's event. Thank you especially to Dr. Ojabele and Dr. Skirkovich. I'm going to get it right. About sharing your thoughts and your feedback. And please, everyone, take just a moment to complete the brief survey that's going to pop up at the end of this webinar when it closes. We hope to see you again in September. Thanks, everyone.